Thank you, Kenya, for the introduction, and Assalamu alaikum, good evening. As you have heard, I'm Nasibo Sarbo, and I'll be your speaker for today's webinar. Thank you all for availing yourselves for today's webinar. So I'll be taking us through the first step of Kaizen, CQI, that is theme selection. And before I do that, I would like us to remind ourselves on what is CQI. So briefly, CQI is a small positive changes that we do in our way of work. It's actually, we can say it's a small, incremental, but continuous progress that we do at our work areas. Though small, but it's incremental. A little bit, or every day a little bit higher in whatever we do. So that is basically what is CQI. Continuous quality improvement, meaning we continuously improve on whatever we do day by day until we reach our goal. You can see from the beginning there is someone who is trying to push something like a ball, which is PDS circle. We'll learn about this in the next slides. But you see from the start is like struggling until he reaches the end. As he climbs up the ladder, when it reaches his goal, it's like now he has achieved his goal. So that is what actually CQI is all about. Starting small and growing bigger. So you can see from this slide that there's a tree where the roots are the 5S, the stem is the Kaizen, and the branches are the total quality management. What does it tell us? In reference to CQI, just the way you can see that there is a leadership and management commitment to watering this tree, to make it healthy, to nurture it, to make it grow well, the same way that even CQI needs leadership, commitment, and support. Without support of the leadership, without support of the management, we cannot achieve what we want to achieve in our various departments, in our various facilities. And again, from the base, the roots are very important. 5S means the roots of whatever we are doing. Like it's basically about improving our work environment, our workspace. When we are not organized, we cannot deliver. So you have to start from your workspace, your work environment, your office where you work from. It has to be neatly organized. It has to be well kept so that you can be able actually to see, pick whatever you want to work with and return. So this basically to eliminate waste and improve on your efficiency and productivity. So by doing that, actually you'll be improving on your work processes, and the work processes are the Kaizen. The 5S is work improvement, eliminating waste. By doing that, you will actually be improving your work process, and at the end, you will have acquired or reached the total quality management, which is combination of the 5S and the Kaizen. And you can see from your right-hand side, it has to be support from both the leadership, that is the top management, and also the lower, as in all the people have to come together from the leadership to other employees or to other staffs in the department or facility or organization for this quality thing to come into reality. You cannot work alone, and you need to work with people to achieve whatever you want to achieve. So what is CQI? CQI, which is also known as Kaizen in Japanese, it's, as I've just said, a problem-solving process. When we have a gap, when we have identified an issue in our area of work, it's actually a problem that we want to solve. So by solving this problem, by solving this issue, by resolving this issue, we'll actually be improving on our work services, on our work area, on the quality of work that we are doing, the quality of service that we are offering to our clients. So the bottom line is we are improving on whatever we do so as to meet the client's need or to meet the client's satisfaction. So, and again, remember that Kaizen is our work. It's not the work of the sub-county QI. It's not the work of the county QI focal person. It's not the work of your manager. It's not the work of your other colleague. It's actually, each one of us should look at it as our work, my work, your work, our work. It's not the work of any other person. And when we implement or do Kaizen, we do with whatever we have. We do with the resources that we already have. It's not like, you know, sometimes people look at Kaizen or CQI like as something that is outside the scope of your work, something that is new, that it's not something that you have been doing day day-to-day, it's not your day-to-day routine, it's actually your day-to-day routine. So, as I said earlier, Kaizen is your work. The target is your work. It's not other people's work. And for this webinar today that you have said, we are going to learn about Kaizen Theme. Kaizen Theme is usually written in a positive wish. It's written in a positive manner because it's something that we would wish to work on. It's something that we would wish to improve on. So, for instance, we would say like, we would like to be, we like to do. Like I can give examples where you want to work on your low skill delivery as a gap. So you say, we would like to improve skill delivery. We would like maybe to reduce long waiting time for the patients. We would like to improve or to increase TB screening in our facility. So it's a positive, which is something that we would wish to do. We have 2 levels of Kaizen. That is a small Kaizen or quick Kaizen, also known as short Kaizen, and a large Kaizen, which is also known as long Kaizen. So for the small Kaizen, is called small because it's small, or short because it can be completed within short time, like a day, 2 or 3. Like it's not, cannot take you more than a week. At most, maybe 3, 4, 5 days will be done by the small Kaizen. That's why it's called short, small, or quick Kaizen. And again, for the small Kaizen, you don't need resources from outside. It's actually just working with whatever you have to improve your work area, your work, the work that you do in your department. And it's actually done by the same people who work like in that particular department. It's not like people from outside will come and work for you to improve whatever you are doing. So it's you guys in that department, in that section, in that unit, that you work on whatever you are doing to improve it. So that's why it's called small Kaizen. Then for the large Kaizen, this is actually something that you need to have proper plan for it. You have to plan for it so that you achieve whatever you want to achieve. And you have to have a baseline data so that you can measure your achievement. Baseline data, maybe like, for instance, you can say you have low skill delivery. So why are you saying you have low skill delivery? Meaning you have a target, but you have not reached your target. You can take an example like you are conducting 20 deliveries per month, and you are supposed to conduct like 50 or 60 per month. That is your target. So you have to have that baseline data that you are at 20 and you wish to maybe reach that 50, 60 or even higher than that. And it actually takes around 6 months for one complete cycle of Kaizen process. So by 6 months, you should have completed one cycle of your Kaizen process. Maybe like a QI project has to be done by within or by 6 months. And once you do implement the large Kaizen, it will actually bring a significant change in your department, in your section, or even in your facility, because it's actually going to affect or to change how you do things. It will be like culture that you are going to instill in your department, in your facility. If maybe, for instance, we say that in facility X, every client, every patient who comes to our facility, he must be screened. So this is a culture that it's instilled in that facility, that whenever you go to facility X, even if you have gone for maternity services, you have gone for FP, you have gone for curative services, you must be screened for TB. So that is a culture that everybody who steps in that facility for any healthcare service, he must be screened. So even if you leave that facility, somebody else comes, maybe you have gone on transfer and another person has come in, he or she must know that this is what we do in this facility. For Kaizen to come into being, teamwork is very important, as you have seen from our previous slide of teamwork and leadership support and commitment. So you cannot do alone. You need teamwork. You need to move together so that you can achieve your intended objective, or you can reach your goal. And once you do your large Kaizen, you have improved on the quality of care that you provide to your clients, to your staffs. Will also increase your productivity. There will be safety of service in the long term. And again, there will be cost reduction and resource input. Why do I say cost reduction? Because when you do large Kaizen, you don't do everything at once, because I believe we all have issues or gaps in our departments, in our facilities, in our sections. So there's so many gaps that we have, we cannot do them at once. We'll pick based on the priority. So by doing that, that will be fixed as a priority. So all our energies, all our resources, all our focus will be to that one thing. So meaning will be like utilizing our resources well. We all know that we have unlimited needs with limited resources. Okay, so why are we today learning Kaizen theme selection? Because for you to be able to implement this Kaizen with QC story or the 7 steps of Kaizen, you need to be empowered. You need to be capacity built. And that is why today we are doing this. We are actually learning this for us to understand how this process happens, how it's supposed to be done. So it's my sincere hope and belief that once we are done with this webinar today, we'll all be very comfortable to do step 1 of Kaizen, that is the theme selection. And I think I've already said that team work is very important. It's very key for us to be able to achieve our intended goal. So how do we do the Kaizen theme selection? How do we select our theme? The step 1 of Kaizen, we have to come together and discuss or list down our gaps, our issues, and then the issues that we have discussed, we are going to categorize them into 2. You can see there is right hand and there is the left hand, the with tick and the with X. So on your right hand, there is a stair, and these are the processes or the steps of Kaizen. You need to start from baseline and going up until you reach your intended goal. For the small Kaizen, maybe it's just like a puzzle. It's not something that will take you long. It's not something that will need so many people to come and support you. Maybe it's something very minor. You can actually do it within a day or 2, like fixing these things together. Like maybe it was not well organized, not well arranged. You just do it. So this actually tells you how simple or short the small Kaizen is. And then for the large Kaizen, now the stairs that you have to check. Then as you come together to list your gaps, to list your issues, you should have these questions at the back of your mind so that you can be able to know which category you should be putting your identified gaps. Like for instance, is this something that you can do immediately? Meaning if something that is going to take you long, then this is large Kaizen. If it's something that you can do within 2-3 days, that is short Kaizen. And again, do you require resources? Do you does it maybe cost, is the cost too much? Or how long does it take you to do it? Such kind of questions should be at the back of your mind as you are coming together and brainstorming your Kaizen themes. So the Kaizen is derived from PDSA cycle. In other books, it's also called PDSA cycle. This means the same thing. Because PDSA cycle is plan, do, check, and act, or you can also call it plan, do, study, and act. So this is an interactive 4-step management process. It's a cycle that is repeatedly done. It's something that you keep on doing. It's continuous improvement, but it's a cycle that keeps on rotating. It's moving. It has no end. It doesn't have an end. Then you actually start small and then go bigger, or you keep on enlarging from the smallest part that you've started going upwards. So what happens under plan? What we have under plan is we actually identify our gaps, we identify our issues, then we list them down, and then again we identify solutions to these issues. If you say you have low skill delivery, what are you going to do about the skill delivery, low skill delivery? What ideas do you have in mind you can solve this, improve on this low skill delivery? So as you plan, you identify your gap, and at the same time, you identify solutions to your gaps. Then under do, now you implement whatever you said are your solutions. Maybe for instance, I can give an example. For low skill delivery, you said you want to maybe bring on board the CHPs, you want to bring on board the TBS, you want to bring on board maybe other people that are concerned with you are increasing skill delivery. So as you do that, you start implementing. Maybe you had targeted like working with 50 CHPs, a good example. So you say